Thanks, Eric and Cheryl. I mean, this was such a fantastic hour. Embraced all the things I believe in, which is being realistic but also positive. So you guys did a great job with that. I mean, just so thankful they came all the way from Texas with 7/8 of their children here. So you can have as much wine as you want on us at the Porta event. So a couple things: that everything that matters needs a system, and everything matters, whether it's in life or in dentisting. So this whole CE thing we said was 9 to 6, and we're done a little early. So one of my tips: has anyone ever had a patient say, like when they sit down, how long is this going to take? How long is this going to take? Is that person just saying, I'm very annoying, I'm very annoying? So I always add 15 minutes. So no matter what it is in your brain, you're like 60 minutes, like 75 minutes, because then that patient's going to take longer. So we're done a few minutes early, but before we get out, I'm going to ask everyone, there's microphones at the beginning of in the middle of the table. So we had this entire day. We talked about patient communication, composites. You guys told me what your chief complaint is, okay? Assistant preparation, staying on time, finding a good job, communicating treatment plans, time management, patient's attitude. This was one of my favorites. How do we make people know we're not a magician, okay? So you guys were here for 7 awesome hours of CE. You got to meet the instructors, got to ask questions, you got to talk with each other, everything I love about a CE course. So to get to pizza and wine and our round table where you're going to meet other experts and other people coming there, all you have to do is do one thing a little bit better each day, makes a lot better dentisting life. So what is something from this entire day that will stand out to you? So if a friend said to you tonight who was meeting you there, hey, what is one thing you learned in this day that's going to help you with your chief complaint? Just to review: patient communication, implants, composites, ceramics, sleep apnea, successful dentisting life here. What is that thing? So you just have to lean in and say that. I also want to applaud both Alex and Kate were great, but when Miles was doing, I don't even know what, not paying attention, I told you that your wife is one of the best members of a CE course I've ever had in the history of CE. Almost enough for her to, she sits in the front, she's always sitting when someone needs to be sitting, not walking around. So Kate, you did an awesome job. Alex, all of you did. So just lean into the microphone and tell us one thing that you would tell a friend tonight that you learned today. It's going to help you with your dentisting life. You're going to think about. And then we can go have pizza, talk, have fun, and have wine. All right. So Kate, you can start us off. Get kind of close to the mic just so we can hear you.
There are a lot of things, but I'd say honestly, I didn't think I would really care about this one that much. But looking at the occlusion as looking at the whole mouth and treatment planning.
Nice. So looking at occlusion as the whole mouth, getting started in a digestible way. Great. Kate, 1 down, 13 to go. Good. Miles, you can move the mic a little down closer to you.
I think I would say be willing to invest in yourself and do more CE like this, because there were too many things to just pick one thing. I think just meeting everybody is like the best part. That's
awesome. Thanks, Miles. I appreciate that. And you're a good sport with letting me be jealous of your body type and everything. But one thing that I've tried to do, because I've lectured for 15 years, I'm a medium-aged dentist, is that it was actually really sad to me. I'd drive home from a lecture, no smartphones, no nothing, and I'd give this lecture to 40 people, or even give them to the Einstein residents, and I was like, oh, this is over, it's done, no one's ever going to see it again, no one's going to hear it again. So all of you get these recordings that you can use as a reference, and that's what I'm trying to do, is create this talking textbook, so that when you want to do that composite a year from now, you say, I'll look at Matt Costa's thing. So I really appreciate that. Stephanie?
I think the last lecture with choosing your life that you want and achieving your goals with purpose kind of applies to all of our chief complaints, because if we make a plan for how we're going to attack this problem, then we can probably do it a little more easily.
Yeah, it's super inspiring. It's like, I think what Cornelius has shared with us is really perfect, and it's just not going to happen in one day, but just making purposeful decisions to do that. Thanks, Stephanie. Good job, everyone, so far. Carly?
All the lectures were great, but this last one I think is is going to help me personally as well to set goals for like student debt and stuff like that. So it was very, very great lecture.
Thanks. And remember what I said in the very beginning of the very first slide, that this entire thing was to make your patients happier, your team happier, but most of all you happier, because that was matters. So that was great. Jake?
Piggybacking off of what the two of them said, just their positivity towards debt, I think that's something that really kind of weighs down, especially when you kind of look at the math, when you get that first paycheck. So that's definitely something I'm going to take away, like the biggest thing from today.
Nice. I like that, Jake. This is also why everyone wants to go last at the Olympics and ice skating, because people have forgotten all about me from 9 a.m. Sorry, just organized the entire thing, started the lecture, planned the whole thing, and people are like, this last lecture, everything about this lecture. Can I say something more about this last lecture? Yeah. So, yeah. Oh, sorry. Move over this way. Sure. All right. Next. To Wilson. Yeah. Well, wine bottle will hug me. That's nice. That's my friend.
I really enjoyed the more technical aspect of the implant placement, but I also have to echo what the last three people have said.
Actually, you don't have to say that because of me. So the technical aspect of implants and also.
It's just I feel like there's a lot of uncertainty right now in my life, so then it's good to see that there is a light at the end of the tunnel.
Thanks. I mean, also one of the things is, everything in life is the same, whether it's dentistry, whether it's being an associate. So everyone wants to know, is this normal? Am I normal? When you have a baby, if it's not sleeping through the night, Cheryl can tell you she's been through it 8 times, so she can let you know. So you just want to know when you're a mom, is it normal? So the stuff when your 6th time is like it's no big deal. Your first time, there's a lot of uncertainty. So I appreciate you bringing that out, Wilson. Jonathan?
I would say, just like cumulatively, there's a lot of topics that were covered today, and there's even more to be covered tomorrow. And being that I've practiced for 5 years now, in the beginning it's really intimidating. Like, there's so much going on. I have to know so much about so many things. I'm never going to learn it all. Yeah. But you have to take a step back and look at the big picture and say, you just have to knock things out one bit at a time. I got to learn about my inclusion. I got to learn comprehensive treatment plan. I have to learn my endo. I have to learn, implant placement. But to see people who have been doing it for many years, and you can't compare yourself to someone who's been practicing for 15 years. You say, okay, well, I've only had 5 years, so I've had 5 years of courses to do this, or in 20 years my loans will be paid off. So hear different people talk about the different aspects of your day-to-day life, and to look at it in the broader scope. That's the main takeaway I'll have from today. Just sort of keep an open mind and look at the big picture.
I think it's great, especially if someone like you who's been, in moving into this TAD to CAD range. It's also like what you said, if you guys come down to our other Nacho office, I'll tell you, I've posted notes like this all over the wall about different things. The Jason Smithson event is so good. And it's more than just, I want to be in good shape and looking at that. It's more about just the things that are happening in your life. Like when you see it, you just remember it. Oh man, we have this Smithson event coming up, New Dentist Boost Camp ICB this time. Oh, this lab case is coming in. I have this CE course coming up. So I love paper like this. And I think, it's like that book, I don't know, Mary's the kindergarten teacher, like eating an elephant one bite at a time, or when we were a kid. So your dental career is a lot like that. So good point there, Jonathan. Next to Jonathan. Oh, so more into the mic they were saying, if you don't mind, like a radio DJ. Here's your chance, Brianna. Easy 106, smooth jazz.
So one thing that I really took away from this is setting your own goals, personal goals, and figuring out what you want to do, what you want to focus on, and following your own path. And just because someone else is doing all these things, like complex things, implants, bone grafts, and all that, just because you haven't done that yet, it doesn't mean that you can't learn to do it or that you have to do it. You have to follow your own path, and don't just because someone else is doing something maybe you think is like greater than what you're doing, doesn't mean you're doing something wrong.
Yeah, I mean, that was just unfortunately dental school sets up this dental student Hunger Games, and it kind of continues on, and it just really bothers me. It's funny, but it really bothers me because no one really does. It's like this whole comparing yourself to others, and Carl Steinberg says all the time, just about your own mission. And also, I wrote I thought it was a good email the other day, but I got a lot of good feedback. Is being successful really stressful? And one of the people who took my implant course is an awesome Mad. That was at the implant course, I think, with Jonathan's group. She said, we had our highest producing month last month, and it was just so incredibly stressful to do all these things for these patients. So even though when you have this perception that someone's done it and it's perfect for them and they produce all this dentistry, it also comes with a lot of stress. So like we are all in this together, and I think that's just a great point to kind of be on your own path. So great, Brianna. Yeah. Craig?
Definitely never stop investing in yourself, and just be nice.
Yeah, I like that. Thanks, Greg. That is a good part of it. It's a good business tip, and that's what we should do more of. Look, I mean, just look to say, even it could be as simple as like, carry on through Facebook. If you see, when someone goes and posts a case on Facebook or of any kind, it takes a lot of courage to do that. And even if you just like it or you just say, thanks for sharing it, it's just so meaningful to people. And it's just like that, one of my mentors, Kyle Kivler, and this happens with raising children or teaching dentists, recognize behaviors repeated. So it's just when more people do that, I just think we get in the vibe of doing that. So perfect, Greg. Ryan?
I think a few lecturers said this, but it's easy to get tunnel vision sometimes, and it's a good reminder that today that we're treating patients, not teeth. And also from what just this lecture, we want to, when you're calling a practice, you want to treat the patient how you would want to be treated when you're calling a practice. So.
Yeah, totally. It's just a holistic approach to everything. Dial down some of the tooth drama with the saving and the ripping out of your best friend, and just dial it down and be like normal. Talk to patients like people and each other, and a lot of good things will happen. So really great, Ryan. Anu?
I would say seeking mentors who will challenge you and kind of push you out of your comfort zone. That's really a good way to learn.
Yeah,
Put
so
yourself
people who
out
will
there.
kindly annoy you and tell you this. So sometimes people come to the new dentist boost camp and they're like, hey, I want to do new dentist boost camp. Sounds good. And other times people ask you a few questions for coming. So maybe you share with them in the most positive way. Did your questions prior to coming meet your expectations? Were they different? You know, like what were some of the things you thought before coming here you were not so sure about? Now you think this is exactly what I thought or didn't think. Any comments on that?
I would say it's beyond my expectations in terms of how many different angles and perspectives on so many different topics.
Yeah, and that's what I'm going for, and that's what I said yesterday in my Mark Dorio lecture. So I'm very confident when I'm presenting implant cases because I know that I'm helping the patient more than they're helping me, and it just comes off me. Like I know, like, oh, it's $40,000. I respect that investment, but I know that their life has changed. I've had so many patients say this is the best thing I've done, and you know what patients say most of the time when you do a big case? I should have done it sooner. Mm-hmm. So when you're a dentist and you say, I should have done this CE sooner or even done anything sooner, that's just to encourage other fellow dentists, because no one goes back and says, I wish I did less CE or I wish I didn't do that course. And I totally get it. It's overwhelming. You have debt, you have this, but getting yourself out face-to-face doing things is so important. Thanks, Anu. Next to Anu, Radwan. Pass that down to Radwan for Anu, for he wants to be right in front of you.
So at the beginning I said I want people to know that I'm not a magician. But I realized today that if I surround myself with the right people, focus on my goals, and go to boost camps, I might become a dentist magician.
Thanks. Yeah, and I think that's really a funny thing to say, and I think it's really poignant, and I appreciate because magicians, it's fake, right? I mean, so they tell you their tricks, and it doesn't mean that they're not fake and bringing joy to people, but they tell you, and that's what a lot of people do here. And Matt Costa tells you what it took to be like him, and how long you have to build it up, and if you want to go on that path, what to do. So perfect, Rodwan. And Alex, you'll get us to the wine time with our.
There's a lot of different avenues of dentistry, and a lot of dentists practice in a sort of repetitive way, in a not thoughtful, repetitive way. So thinking about how you want your career to evolve and the paths that are out there, and sometimes it's foreseeable and sometimes not, and that's okay too.
I think that's a perfect end one, because a lot of the things I always talk about on my podcast with Rob Montgomery is just general awareness. So, I mean, it was the same thing. Some people are sitting here watching Matt do that fancy composite, and probably someone like Miles like, I'd like to do that. That's exciting to me. And then other people are watching Dave Slobodinsky talk about sleep apnea and be like, maybe that's not for me, but I'm glad I know about it because I can tell my patients something about it. That's the whole point of everything, of being a good dentist and kind of being a good person, being aware that these things exist out there so that you just share them with people. A lot of times, if you ever think about this, I talk about implants all the time, not to drum up more business or things like that, because somebody might have an aunt going through that situation. So even if I'm at like a party and someone's like, oh, what's the deal with implants? And they don't ever say it in a way that's positive. I say, oh, a lot of people like it because they'll tell someone else. I mean, that sleep apnea part is it. I mean, Dave's journey to be that person is a long journey. I bet you one of you guys are going to want to do that with sleep apnea, or a couple of you guys. But the ones who don't, like, I don't have any desire to do that myself. He's in our office. But I'm glad I can screen for this in my patients. So awesome first day, guys. We're done early. Live streamers, we'll see you tomorrow at 9 a.m. Thanks for hanging with us.